We're all aware of the link between smoking and cancer, but what about drinking? A new study links alcohol consumption to increased risk for cancer. Joining us now to discuss this, our medical specialist, Dr. Karl Kabasele. So many people know there are negative health effects from drinking, but most people don't know about the link with cancer. Explain what the study found.
Well, that's right, and in fact, the World Health Organization has designated at least 7 cancers as being linked with alcohol consumption. But these researchers in the U.S. wanted to quantify that a little bit more. So they looked at those top 7 cancers associated with alcohol, and here's what they found. They found that 3.5% of those cancers, or cancer deaths, I should say, were attributable to drinking alcohol. But they also found that for those deaths, on average, people were losing 18 years of life. So clearly there is a health impact from drinking.
All right, so how much then do you have to drink in order to get that risk?
Well, I brought here some cranberry juice actually to stand in for alcohol to give you a sense of how big a standard drink is. So the large glass here would be the amount of beer in a standard drink, 12 ounces. You have 5 ounces of wine if you're going to drink wine, and 1.5 ounces of spirits or hard liquor. So it really just depends on the concentration of alcohol in each drink. Now, the bad news is that any amount of alcohol appears to increase the risk because when it comes to cancer-causing factors or chemicals, there's no real safe dose. So just 1 drink a day can still contribute to that cancer risk.
All right, but offsetting that risk, research has shown that drinking 1 drink a day is good for your heart and can prevent strokes. So how do you balance those?
Yeah, that's the tricky thing, I suppose. Now, the interesting thing about alcohol is it seems to thin the blood. It makes you less likely to have clots, and that's where you get that protective effect against heart attacks and strokes. But having said that, I would not prescribe someone to drink alcohol for the benefit of their heart. There are many other things like diet and exercise and so on that will help to protect your heart and prevent strokes.
All right, well, this is all sobering news. Thanks so much, Dr. Karl Kabasele.
Thank you.